Hello, and welcome to my channel, Kate's Low Vision Living. If you're new here, welcome. If you're back, welcome back. Today I'm going to go over my post-op. It's been 2 weeks since my ulnar nerve transposition surgery on my left elbow, carpal tunnel surgery on my left wrist, and my steroid injection on my right thumb. So it's been quite an eventful week since I posted last week. Last week was, let's see, I guess it was just 1 week since my surgery. And we had unwrapped it, and then the sutures had looked good, and my range of motion was fine. I just, wasn't doing any heavy lifting, any pulling, pushing, anything with my left arm that way. Nothing like pushing up from your chair or from the bed, which is not good. So everything was going fine. Sunday night, we were asleep in bed. My husband woke up coughing and kind of like coughing, choking, and it startled me. So I jumped up to see if he was okay, and I realized that my leg was wet, and I thought he had coughed something up, and I was worried about him. I turned on the light, and I realized that where I was laying in bed was wet from where my elbow was. So I went into the bathroom, and then at that point, my elbow, where the incision was bleeding. So made sure my husband was okay. Then we dealt with my elbow. We just thought, it was just like a little, one stitch had busted open. When I looked at the bed later though, there was like an area where my elbow was, and there was a good amount of fluid that had come off my elbow. And I know that's not uncommon for surgery sites or wounds, that you'll have, your body produces, it's inflammation and it has fluid. And as the swelling goes down, your body absorbs it. So, it was still leaking the next day, coming out, and I could feel my sleeve getting wet. It wasn't a lot, and I was happy that it was clear-ish yellow. It wasn't like, I know this sounds bad, but it wasn't pus or white, or I didn't have any streaks going up my arm like an infection. That was Sunday night. Monday morning. So Tuesday, I was going into Harborview Hand Clinic to have them look at it and take out the rest of the sutures. So we just waited it through, made sure that I babied it and nothing happened. We went to Harborview Tuesday morning, saw the nurse practitioner, and she looked at it. She said, yeah, you just busted, one little stitch came out, and that it's normal that it'll seep. Make sure that, leave a gap there for it to seep, because you want that to, the fluid to come out. You don't want to trap bacteria or, things in it to cause an infection. So she pulled out the rest of the sutures on my wrist, which looks really good. I haven't put any vitamin E oil on it yet. I'm just kind of making sure that it's all healed up a bit more. And then, so I'm trying to do my hand exercises too, like these. And then she took out the rest of the stitches on my elbow. I do have it covered now. It's really shoddy. I don't know if I mentioned, I'm legally blind. I have no central vision. So my husband has been, well, not only that, it's in a very odd place for you to, for a normal person to see too. So you have to like look in the mirror and fiddle with it. So he's been really good at looking at it, cleaning it up for me, and putting a bandage on it. But this morning it had seeped through. So I wanted to make sure it was clean, got some sterile gauze. Just kind of slapdashed it on there with some tape, hoping everything was fine. So with that said, she had taken the rest of the sutures out, said leave the steri strip, like the butterfly bandage, on that with a little gap for the fluid to get out. So yesterday was Wednesday, and everything was fine. I had put and I don't know if this is what caused it. I'd put like an elbow pad brace on it over the gauze, and then later on in the day I'd taken it off to let it air out, and I think I was reading on my iPad or something, and I had my elbow resting on a blanket, and I lifted it up and there was blood on the blanket. So I got very stressed out, and I couldn't see it very well in the mirror, but my husband was coming home from work. So when he came home, he looked at it and said, we need to go to the ER because it busted open a good inch now. And I didn't want to go up to a place where Harborview or UW wasn't involved since they did the surgery. So we finally called Harborview, and they said to send them pictures of it. They referred it to 2 other doctors to look at, as well as the surgeon who worked on my elbow. She called me back. I was thinking that they wouldn't call me back because she said if you didn't hear from them, just to keep the steri strips on it, and they'd see us in a month. But they called back and said they wanted to see me on Tuesday when he's back in the office to do a wound check, and that to don't put anything on it except for soap and water, gently pat it dry, let it kind of air dry. Don't put hydrogen peroxide on it, don't put Neosporin, don't put anything on it. Just dry sterile gauze and the tape on it. Let it seep as much as it's going to. And if that changes, to let them know. If the coloring changes, anything like that, you break out in a fever. So with all that said, I can't say that it's not been stressful. It's been painful too. My elbow, I'll point to it on my right. It hurts like right in here, kind of like it did before I had the surgery. So I'm hoping that there's nothing wrong with the internal stitches that they did, and I didn't do something wrong, or it's needs to be fixed. I don't know. It is very stressful. So today I'm just trying to, again, not do anything. She said not to lift anything heavy, push, pull, anything like that. So it's kind of hard because you have to rest your arm. Like when you sleep, you're always kind of resting on that incision. It's hard to keep it that way, or if you're sitting in a chair, you're constantly on that. So today I've just been kind of sitting in bed, propped up, with my arm kind of like this a little bit, stretch it out so it's not resting on that incision. So my best advice is, and I'm not a medical doctor, but make sure you do what your doctor tells you to do with this ulnar nerve transposition, cubital tunnel surgery. But if I had to do it over again, I would have been more cautious and not lifted. I think I lifted the Instapot yesterday. That could have done it. Who knows? I think I would baby it more and be extra careful. So that's it for the update this week. So it's 2 weeks post-op of my ulnar nerve transposition. I will update you next week after I go back to the doctor, to Harborview Hand Clinic on Tuesday. And we'll see what they say, or whether they're going to restitch it up. I don't know. So other than that, the thumb, my subluxed thumb here, where they did the steroid injection, is extremely well. No more pain in it, and the swelling's gone way down. So that worked out really well. And the carpal tunnel has done really well. No more pain and swelling in these fingers. So 2 out of 3, I guess. So thanks for joining me on my channel. I will update again next week, and I also have other videos of my low vision life on cooking, gardening, arts and crafts, and also my autoimmune disease, which is undifferentiated connective tissue disease. So I hope everyone's well. Take care, and I will see you next week. Bye.